we should anticipate that we very well may get another variant that would emerge that would elude the immune response that we've gotten from infection and or from vaccination.
Dr. Anthony Fauci warning about the possibility of a new COVID variant emerging and urging people not to let their guard down as we head into the winter months. He also encouraged people to get their booster shots, including the new updated shot that targets the Omicron variant. Now, according to new research by the Commonwealth Fund, if 80% of eligible people receive their booster dose, it would prevent about 90,000 deaths. Joining Morning Rush this morning is Dr. Amish Adalja, a senior scholar at the Johns Hopkins Center for Health Security and an adjunct assistant professor at the Johns Hopkins Bloomberg School of Public Health. Thank you so much for joining us today. Always good to see you. So according to the CDC, about half of people eligible for a COVID booster shot have not gotten one. Why are people reluctant to get the booster at this point?
It's probably multifactorial. A lot of our messaging on boosters has really not reflected the fact that we really want high-risk people to be the people that are boosted. And we've got this universal message. So sometimes that message to the high risk gets diluted. People think this is just another booster. The other thing is we're encouraging people to wait several weeks if they've just several months, actually 2 months, 2 to 3 months, depending on whether they've had an infection in the past or had another booster. So that may cause a lag. But in general, there's a lot less enthusiasm. And I think it's really important with booster messaging that we target people that are at risk for severe disease, especially those that have never been boosted. Those are the people we want to be boosted. So I don't necessarily look at the number, the raw number. I wonder who's getting boosted. And if it's high-risk people, I feel better than if it's lots of low-risk people getting boosted.
Yeah, that makes a lot of sense. So we heard Dr. Fauci talk about the possibility of a new variant. We know that that's a strong possibility. So what kind of protection will the updated booster, which targets the Omicron variant, what is that going to provide for any new variants that may emerge? Because someone at home may be thinking, hey, if I get this shot, it targets the Omicron variant, and another variant comes up in about 2 months, and what's the point?
We don't fully know what the level of protection is going to be against new variants. What we know is that even the original version of this vaccine protects against severe disease, hospitalization, of death, even against the Omicron variant, which is very different than the original version of this virus. However, when you look at all those variants that are emerging, they are all descendants of Omicron. So there is this biological plausibility that updating the vaccine to better target Omicron is going to give you better protection against those Omicron descendants. How much better, we don't know. Those studies are ongoing now, but it's not likely to be worse than what we had before. And again, it's really important to remember that severe disease, hospitalization, and death are the most important factors when it comes to vaccination. And that's what vaccines do really well. We're trying to shift COVID to an outpatient illness, and that's what the vaccine allows us to do, even if it doesn't block every infection.
All right, really quickly, we're just about out of time here. Doctors are also encouraging people to get the flu shot because we're heading into these winter months. Is it okay to get both at the same time? Is there any concern of getting a flu shot and a booster together?
No, it's completely safe to get both the COVID-19 booster vaccination and your influenza vaccine at the same time. You may have a little bit more side effects in terms of aches and pains and muscle aching where the injections were, but it's completely safe to do so.
All right, Dr. Amish Adalja, we appreciate your time as always. Good to see you. Thank you.
Thank you.